Hi, my name is Emily. I'm going to be your nurse today. I'm going to go ahead. Can you tell me your name and date of birth? All right, awesome. And do you have any allergies? All right. So I'm going to go ahead and do a full set of vitals on you, do a head to toe assessment, and I'm going to go over any of the doctor's orders that he's prescribed, answer any questions that you guys might have, and I'm also going to talk about some of the plan of care that we're going to do for you, okay? All right, so I'm going to look at your vitals. Your temperature was 101. Your heart rate was 145 and irregular, which is very rapid. Your respirations were 32, or a little elevated, and your blood pressure was 120/76, and your O2 stat is at 89 with your nasal cannula. I would also, at the beginning, make sure that I check her IV site, make sure it's patent, it's not red, there's no tenderness. Check the tubing, make sure that it's not kinked, it's hooking and running up correctly. If she had a catheter, I would check the tubing, make sure it's not kinked, make sure it's hooked to an immovable part of the bed. Watch for any obstacles in her way to go to the restroom. Her room is well lit, and nothing that she could trip and fall over. Alright, so I'm going to go ahead and do a little assessment on you. Since I already took your vital signs and we know, I'm going to have you turn your head, and I'm going to have you turn your head the other direction. Okay? I'm just going checking for your JVD, which is jugular vein distension, and this happens when you have some fluid overload. Okay? I'm going to go ahead and feel your arms. Okay, are you having any pain in your arms? No? Alright. She doesn't have any edema in her arms. They are pink, warm, and dry to touch. I'm going to go ahead and take a listen to her heart sounds and lung sounds. I'm going to do 6 on the front and 10 on the back when listening to her lung sounds. Alright, so you do have some crackles bilaterally in your lungs. Your heart rate is very irregular and very rapid, and that is coming back to the findings that we did find when you came in. Are you having any pain in your upper extremities? Any pain in your stomach? Okay, a little bit of tenderness in your stomach. Alright, so I'm going to go ahead and listen to your bowel sounds, make sure that they're active and there. And then I'm going to go ahead and palpate your stomach, and I just want you to tell me if there's any pain when I do palpate your stomach, okay? Alright, so there is bowel sounds times 4. Are you passing any gas? Yeah? When was your last bowel movement? Okay. Her stomach is flat, not distended. It's soft, and she does have a little bit of tenderness there. Okay, I'm just going to go ahead and have you pull down on my hands and push up on my hands. And I'm going to check your cap refill. I would do this before I started going down any farther on her body. I'm going to go ahead and check your legs. If I would have gone to the legs and worked my way back up, all I would have done is just rewash my hands. I'm going to feel for her cap refills less than 3 seconds. She does have pita pulses present. Are you having any pain when urinating? No. And is your urine cloudy or is it clear? Clear? Okay. So, with the crackles bilaterally, it does have a little bit to do with your asthma. And you do have that very fast heart rate. So what we're going to go ahead and do is do some diagnostic tests. The doctor has ordered an EKG for you and some CBCs, thyroid panel, ABGs, just to make sure and look at any of your lab values and see what's kind of going on, and we can then rule out any type of illness that we possibly think until we can actually get the correct diagnosis for you. But for right now, I'm going to have the respiratory therapy come in, and they're going to intubate her to help with this airway. And then I'll come back and interpret any of those lab results that have come back, and then go through any of the doctor's orders that he has ordered, okay? And then we'll get a little bit into what's going on from those lab values and what we found, okay? All right. Knock, knock. It's me again. It's Emily. All right, so we did get some of your lab values back, and the ones that really stuck out was your thyroid stimulating hormone. It is very low. It's at 0.1, and that just kind of shows that there is something obviously going on wrong with your thyroid. And what we are coming to conclusion with everything, with the heart rate, and the ABGs that came back, the CBCs, all of that lovely stuff, we have come to the conclusion that it is thyroid storm. And that would indicate the elevated heart rate, any of your nausea and vomiting that you've been having. And again, it's reflected in that lab value that came back of 0.1 of your thyroid hormone. Okay, so some medications that we're going to give or possibly give you would be beta blockers, antipyretics, so some levothyroxine, which is also known as a thyroid medication. But the one that we are going to administer is pantoprazole, 10 milligrams PO for 3 times a day. And we're also going to give you some normal saline, half normal saline at 100 milliliters per hour. Okay, some side effects that could come from this medication would be wheezing, lightheadedness, weakness, some shortness of breath. But we use this mainly for heart rhythm disorders, and that would also help with this heart rate that we have going of 145. Okay, so to answer your question about what caused this storm or crisis, would be the pregnancy. The pregnancy puts a lot of stress on the body, and so does childbirth, okay? And in a lot of cases, not all cases, the thyroid will change during the pregnancy. It can make higher thyroid stimulating hormones. It can lower the thyroid stimulating hormone. But needless to say, it does change the levels. And in your circumstance with the anxiety and everything else, it has caused the thyroid to bottom out. And this is the side effects of it. So it is treatable. We can help with that. It is going to take quite a few days for her to get back to normal, but we will be able to get her back up and normal, especially with this medication, if she takes it correctly. Again, with the medications, we just want you to know that you need to avoid alcohol, slowly changing positions because it can cause that lightheadedness. You don't want to skip doses. If you do skip doses, make sure that you take it as soon as possible unless it's within 4 hours of the next. And don't chew it, don't crush it. It's an extended release tablet, so you want to keep it all together, okay? Because it can affect the release of it. Okay, so I'm going to go ahead, grab my MAR. We're going to go ahead, hang some half normal saline, and I'm going to go ahead and give her PO medication, and I will let you guys be, okay? All right. Knock, knock. Okay, I have all of my products that I need to give you all of this. Can you tell me your name and date of birth? And do you have any allergies? No, I'm just going to go ahead and double check on your wristband that everything matches up with my MAR, what's in the computer, and what you told me, and it does. So the first thing I'm going to go ahead and do is I'm going to administer your IV medication. What I'm going to need is my half normal saline. I'm going to need my primary tubing. I do have secondary, but it'll work for now. An alcohol prep pad and a flush, and I need some gloves. So the first thing I'm going to do is she has a saline lock on currently, so I don't need to start an IV, but I'm going to take the hub of her saline lock and I'm going to make sure that I clean it well with an alcohol swab. The first thing I'm going to do is clamp off the tubing so that there's no medication when I spike this bag going through. I'm going to take the little end off, going to take my end and spike the bag. Make sure it's in there fully. I'm going to go ahead and take a squeeze at the chamber. Let that fill up. I'm going to open up my roller clamp until it's completely primed. And then I'm going to close this off. Let's sit down. I'm going to open up my alcohol prep pad. Wipe off the hub. Take a saline flush. Flush the lock to make sure it's still patent. Okay? And then I'm going to go ahead and clean the alcohol with alcohol swab again on the hub of the saline lock and of my primary tubing. I'm going to screw on the primary tubing and unclamp my roller clamp to allow it to flow. I'm going to put on a medication sticker with a name, date that it was started, the drug, the amount, who started it, the time that it started, and the flow rate of 100 milliliters per hour. And I want to make sure that it is flowing, check the IV site, make sure it's not infiltrating. The main reason for the saline flush is to watch for any infiltration so that if it did infiltrate, it's just normal saline and not any type of medication. So while that's running, I'm going to go ahead and change my gloves since I will be touching a medication. I'll throw those in the trash. I'm going to go ahead and grab another set of gloves after I washed my hands. I'm going to grab my medication bottle, ask her again for her name and date of birth if I leave the room. Can I have your name, date of birth? And do you have any allergies? I'm going to double check again on her wristband, make sure that everything matches. I'm going to look at my doctor's orders. I'm going to look at the MAR. I'm going to also look at her wristband to make sure everything connects. Look at the bottle to double check that it is the correct milligram. And it also matches up with the MAR. So I need to have pantoprazole, 10 milligrams PO, intercoded, which I do have. It corresponds with the MAR and what is set up in the computer with the doctor's order. So I'm going to go ahead and dump out in a container 10 milligrams of tablet. Go ahead and give this with her and a drink of water. Alright. I would document the date, time, what I administered, how the patient tolerated it with the IV. I'm also going to document any known allergies, that she didn't have any allergies, so I'd make sure to document that she had no known allergies at the time. And I would also document the education that I provided, side effects that I was told, and also, again, how the patient tolerated it with both medications. I'm going to go ahead and let you be for a little bit, and I'm going to come back in about 30 minutes to check on you. Make sure that you do put your call light on if you do have any of those side effects, shortness of breath, wheezing, lightheadedness, and weakness, and I will come in and do another assessment on you. But for now, you're good to go to rest, and I will see you in a little bit.